Dr.Capeの特A級対策。本日はエッセイを2本ご紹介します。国際社会とコロナ禍。コロナと海。この2本目の方は UNCTAD Maritime Transport Report をベースに書かれています。楽しみです。本日の2本のお題はこちらです。
Why and how will vaccine nationalism be the next serious hurdle for the international community in dealing with the COVID-19 pandemic crisis? What has COVID-19 affected the maritime industry?
一つ目のエッセイでは COVID-19 とワクチンのナショナリズムにフォーカスしています。1、ワクチンの配分。2、理想的な優先順位。3、先進諸国が確保。4、WHO の声は届くのか。限りあるワクチンをどのように配分すればいいのかっていうのをフォーカスしています。
Once the successful COVID-19 vaccines are made commercially available, the market will face a staggering global demand. The question, at least initially, is how to distribute the limited supplies. Can we treat the new vaccines just like any consumer products? Should we let market price dictate their distribution?
理想的な優先順位ですね。配分の優先順位を考えると、日本はそこには入らないんです。
What if our goal is to maximize the number of the lives saved and to slow down the disease transmission? Our rational thought helps us envisage respectable ways of prioritizing among vaccine beneficiaries. For instance, the first shots should be given to the world's healthcare workers, then to those at a higher risk of severe diseases, then to those in areas suffering from rapid infection, and to the rest. In this case, Japan as a whole cannot be listed high in the priority order.
ワクチンの優先順位にかかわらず、それを確保するのは先進諸国です。
Japan thus is likely to acquire a large stock of successful vaccines for immediate inoculation and hoarding, betraying the above-mentioned rational and humanitarian priority scheme. In fact, the governments of other developed countries, even if their citizens are relatively low risk, have placed advance orders for huge amounts of doses of vaccines, likely leaving little for poorer parts, with inadequate medical facilities of the world.
WHO はワクチンのナショナリズムをやめてくれと言ってますが、その声は届くのでしょうか。
We are beginning to witness the period of contending vaccine nationalisms. The WHO has begun to call for resisting vaccine nationalism, particularly in wealthy countries. It is argued that the countries that keep vaccination treatments to themselves cannot expect to open their society to the world soon.
2本目の方はですね、UNCTAD Maritime Transport Report の方に基づいて書かれて、なんと SDGs が出てきます。まず1、Goal 14 of SDGs。2、コロナとプラゴミ。3、短期的解決策の余波。4、持続可能なコロナ対策を。はい、山ちゃんの大好きな SDGs 14.1 のターゲットが海、海洋ゴミですね。これがなんと COVID-19 パンデミックと深い関わりがあるんです。
The issue of maritime debris in general, and plastics and microplastics in the oceans in particular, has given rise to some of the greatest environmental concerns. As a result, the international community has established Target 14.1 of Goal 14 of the 2030 Agenda for Sustainable Development to prevent and significantly reduce maritime pollution of all kinds. What is relevant to our discussion in the context of the COVID-19 pandemic is those land-based as well as on-board ship activities that are linked to marine debris.
はい、コロナ禍といえばもうプラスチック祭りです。医療現場でも全世界的に使われている消毒液の容器も、そしてテイクアウェイオーダースの容器も全部プラスチック。
The COVID-19 pandemic has raised the fear of contamination in society, and a number of protective measures have been implemented to cope with its contaminating strength. As frontline institution, as to confront the disease, many medical facilities have obliged their staff to be heavily armed with surgical gear and deploy various medical appliances and tools, many of which involve the use of plastic. More broadly, people have increased the use of liquid sanitize, or for washing their hands, and cleaning human-to-human contact points, such as doorknobs. Restaurants have relied more than before on takeaway orders, which are served with single-use, disposable plastic items, such as food containers and utensils.
膨大な量のプラスチックゴミ、結局海に流れ込むんですね。いや、今はそんなこと言うてやれへんというかもしれないですが、この後、大変なことになるのは目に見えていますね。
There is a risk for these items to end up as litter in the environment, including in the sea and along beaches, which in many countries are a mainstay of the local tourism industry. Short-term solutions to address an increase in plastic pollution arising from the ongoing pandemic may include fines, placing labels indicating disposable items, and making information on littering and how to recycle more available to the public. Public attention on plastic pollution is likely to increase in due course once the immediate COVID-19 threat subsides.
コロナも人類の危機ですが、海が死ぬのはもっと怖い。研究者たちは持続可能なコロナ対策を呼びかけています。
In the meantime, researchers suggest recycling single-use plastic items, limiting food deliveries, and ordering from grocery supplies that offer more sustainable delivery packaging. In addition, wearing reusable face masks, disposing of single-use face masks correctly, and buying hand sanitizer contained in ecological sustainable packaging should also be considered. But at this very moment, it seems that priority is on the protection from the pandemic, rather than on the reduction of environment pollution, even though they are far from mutually exclusive.
はい、プラスチックゴミは私もずっと国連年金対策をしている時から非常に気になってて、なんとかプラスチックの有効活用ができないのかっていうので、このようなサイトですね、Turning Plastic Trash into Treasure というような概念で、いろんな人たちが活動してるんですよね。リンクの方を下に貼っておきますので、ぜひ参考になさってください。左上の動画は 3D プリンターを使ってゴミをリサイクルするという動画なんですけど、すごい感動しました。今 3D プリンターの技術も進化してますから、ゴミをなんだりかんだりできたらいいですよね。もっとお手軽に家でポイッと入れたらプーンって出てきてそんな簡単にはいかない。はい、そして次回の題はこちらです。アメリカと北朝鮮です。楽しみですね。Thank you for watching. I see you soon.